Hello, I'm Dr. Lawrence Brown, the Director of the County Health Rankings and Roadmaps program. We are proud to present this special webinar series on the way that communities are responding to COVID-19. Throughout this series, we will lift up the social and economic dimensions of the current pandemic. In addition, we aim to highlight the historical context of place and space to help explain where and why COVID-19 hotspots are emerging. Finally, we will provide a forum for the stories of impacted communities and their innovative solutions that we hope you will share and lift up. We also know that before the pandemic arrived and now, not everyone has had the same opportunity to live a long and healthy life. Story after story in the news media shows the disproportionate impact of COVID-19 in Black, Latino, and tribal communities. This pandemic is shining a light on long-standing inequities that exist in this country because of racism, historical trauma, urban apartheid, and rural disinvestment at every level, designed to create barriers to opportunity that we must overcome. We intend for this webinar series to be an opportunity for community leaders to come together, examine the inequities this pandemic has exacerbated, and explore data and evidence-informed strategies that can enable positive change both during the time of crisis and during the time of recovery and healing. We encourage you to share what's working in your community and learn from others who are also making tremendous strides. Let us work together to build a new nation on the foundation of health equity and social solidarity.
Hello, and welcome to US COVID Atlas, Exploring Data to Move to Action, a County Health Rankings and Roadmaps webinar. The County Health Rankings and Roadmaps is a program based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. I'd like to acknowledge that this program is the result of the contributions of many colleagues and partners, some of whom you'll meet in just a few moments, that are in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. Hi, everybody. My name is Joe Hinton, and I am one of the Action Learning Coaches for the County Health Rankings and Roadmaps program. And I am coming to you today from the Rogers Park neighborhood of Chicago. Today, I am joined by some of my wonderful colleagues. The first one that I would like to introduce to you is Ali Havrilla. She's in Smithburg, Maryland. Hey, Ali.
Hey, Joe. So glad to be here today, and I'm going to be behind the scenes answering questions. So just encourage folks to find that Q&A box and share any questions as they arise.
Thank you so much, Ali. And yes, everybody who joined us early saw the Q&A button on your Zoom interface. Be sure to enter any questions you have in there, and Ali will help us get those answered today. The second person that I would like to introduce is Courtney Bloom from our Data and Science team. She's also going to be in the Q&A space, and she's also going to share some additional data insights with us later. Hey, Courtney.
Hi, Joe. Hi, everyone. Happy to be here.
Great to see you. Thanks for joining us. Some other colleagues that I would like to introduce to enhance your learning experience today. First is Raquel Bornanesk. She's going to be chatting with you in the chat box. Hey, Raquel, how are you?
Hi everyone. I look forward to chatting with you today. And when chatting, please change your default by selecting all panelists and all attendees so that everyone can see your chat. Thanks.
Great tip. Thank you, Raquel. Make sure everyone can see those chats that you put out there. And last but not least, I'd like to introduce our technologist. His name is James, and he's going to help you with any technology needs you might have today. Hey, James.
Hey, Joe. I'm really glad to be here. It's my privilege to be helping with this really worthwhile topic. And if anybody has any technical issues while the webinar is going on, please instant message me in the chat window and I can get right back to you.
Thanks so much, James. We couldn't do it without you. To round out our group today, I would like to introduce you to our guest for the webinar. Her name is Marynia Kolak. Marynia is a health geographer and the Assistant Director for the Assistant Director for Health Informatics for the Center for Spatial Data Science at the University of Chicago. Marynia will be sharing the very informative US COVID Atlas with us today. Welcome to the webinar, Marynia.
Hi, everybody. Thanks so much for having me here, and I look forward to chatting.
We're glad to have you. And I had to call out what part of Chicago I was in because Marynia is on the opposite side of town, but we'll be able to both be in Chicago at the same time. Before we dive into talking about the Atlas today, I would like to tell you a little bit more about the County Health Rankings and Roadmaps program. We have two primary overarching goals for the program. The first goal is that we want to improve health outcomes for everyone. That includes both how long people live and how healthy they are throughout their life. The second goal of the County Health Rankings and Roadmaps is to close health gaps between those with the most and least opportunities for good health. We, like all of you, I'm sure, believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or what circumstances we're born into. We know that our choices for health that we make depend on the opportunities we have. If given the choice, we would all have our children attending quality schools, living in safe and affordable homes in safe neighborhoods, but we're increasingly aware that not everyone has these same opportunities. The COVID-19 pandemic has made it even more evident that opportunities for long and healthy life are not equal among all people. If you joined us at the beginning, you heard from our director, Dr. Lawrence Brown, and he helped us reflect on things like past and current structural racism, urban apartheid, community trauma, disinvestment in urban and rural communities, all of these further exacerbating disparity, especially in Black, Latinx, and tribal communities. Those communities have borne a disproportionate impact from the virus. Another thing that we're increasingly learning during the COVID-19 pandemic is that we have been confronted with an endless stream of data. It floods our inboxes, it floods our news outlets, it's on our social media. And as communities grapple with the disparities that they're uncovering and the different impacts that the virus is affecting within their community, they'll start to turn how to implement different responses. It's going to be increasingly crucial for us to connect all of that data that we're learning about with our local community context. So with all of these ideas in our mind right now, I'm going to ask all of us to chat in a response to a question. And I know that Raquel is going to put the question in the chat for you to respond to. But I'm wondering, what have COVID-19 data taught you about your local community need? So take some time to think about that question, put your responses into the chat, and just a little while later, we'll ask Raquel to lift up some of the things that she's learning from your responses. Also here at the top of the webinar, I would like to tell you about our discussion group. After our webinar today, we will have an opportunity to dig a little bit deeper into our learning about exploring data and moving to action. We offer an interactive discussion group where you can join and share a little bit more of your learning and thinking about our topic today. In that discussion group, you'll have conversations with our guest, with members of County Health Rankings and Roadmaps staff, and with other webinar attendees. You can share what you're doing locally, you can ask questions of each other and of other participants, and it's a really great opportunity to connect with each other. We're pleased to be able to offer all of our discussion group sessions in collaboration with our partners at Healthy Places by Design. Our great colleague, Joanne Lee, I know she's in the room with us here today, will be the lead facilitator of our discussion group. Joanne always does a great job of getting everyone involved in the conversation. I know that Allie and Courtney and Marynia are all planning to join in the discussion group, and we hope that you'll stick around after our webinar to join us as well. But you don't have to worry about the discussion group yet. We still have plenty of time together here in this setting, and Raquel will send out details about how to connect for the discussion group later on. At this point, though, I think we should turn our attention to the COVID Atlas. So I would like to bring our invited guest, Marynia, back into the room. And just to kick us off, Marynia, I wonder if you could tell us a little bit more about the US COVID Atlas, the challenges that your team wanted to tackle with your work, and really just acquaint us with the product.
Definitely. So first, I guess I should give a little bit of a background for the context and how the Atlas started. So our team had been following the pandemic closely since the original outbreak in Wuhan back in December. By early March, we had identified several emerging challenges that impacted a more comprehensive understanding of COVID. First, there was a lack of publicly available county-level surveillance data. By focusing on statewide or even US-wide metrics, it's really easy to miss rapidly surging cases at a more local level. Identifying outbreaks earlier on is critical to isolate effectively. For example, a hotspot would have to be extremely large and mature, and therefore even more difficult to contain to be flagged as a hotspot at a state level. At the same time, in early March, there was a focus on large cities and one's own areas, not what might be happening in surrounding places. This makes it difficult to understand what's happening in a comprehensive ways, as things tend to be hidden. Adjusting for population is also critical to understand how some areas, particularly rural areas, are being disproportionately hit by COVID. Prior to this pandemic, I had been analyzing the spread of the opioid epidemic at a local level and how where you live impacts your health, and saw the importance of approaching these challenges as complex systems from a regional perspective. So in addition to identifying areas of highest risk, we also need to detect vulnerable areas to again isolate and contain cases before they get worse. So we pivoted, and with co-PIs Chingyun Lin and Xuan Li at our Spatial Data Science team, we created the US COVID Atlas, which uses the county level approach. So to give you an idea of how both scale and visualization style impacts how you understand the pandemic, first look at this classic map of COVID rate this is COVID cases population adjusted in early June. From this view, we can see that Illinois is flagged as a problematic area. Arizona, New Mexico, Alabama, not so much. When we shift to a county level view, it's immediately clear that the hotspot in Illinois was mainly one large city, Chicago, in early June. States we weren't worried about before are clearly highlighted as concerning areas now. High rates between Arizona and New Mexico in the First Nation communities like Navajo Nation were averaged out when aggregated to state levels and therefore missed. Some of the highest rates in the country in Alabama and Mississippi were also completely missed. But our brains are programmed to detect patterns whenever we see data and visualizations. Are those areas true hotspots, or was I just struck by a pattern of colors from looking at the map too long? For that, we turn to classic spatial statistics and use an algorithm to now very plainly see three large clusters of high COVID rates in each of those areas highlighted. And here the algorithm is essentially identifying areas of high COVID rates. And so both the county has high COVID rates and surrounding counties also have high COVID case rates. So it includes not just the county, but the neighboring counties in the formula. By adding a time dimension, we can next determine how stable those red hotspots are over time. If they persist and begin to grow or spread, then obviously they become priority areas for COVID containment. So all of these visualization options and hotspot statistics are in the Atlas. The Atlas provides a much more detailed landscape, therefore, of the disease and helps us see things that were previously hidden. We also add a time slider to see how the data and statistics change over time. The Atlas gives you a deep dive into the pandemic, updated with fresh data daily by 3 p.m. I should note that today we are delaying the fresh data update till a little bit after 3 p.m. just to make sure that everyone has the best experience possible as they're watching today.
Good news.
So we try to provide various data dimensions to give you clues to make the detective work of understanding COVID locally even more accessible. That means adding contextual layers of the communities hardest hit, like Native American boundaries, hypersegregated cities, and the Black Belt in the South, which I'll talk about a little bit later. We also link dozens of community contextual and health data indicators through our partnership with County Health Rankings to illuminate more dimensions of the pandemic at a local level.
And I have to say, I really do appreciate all of the added features that the Atlas contains. When I first started exploring it feels like months ago, but just maybe a few weeks ago, some of those features weren't present yet, but the map overlays, the inclusion of the social and economic data have really increased even my personal understanding of the pandemic. Can you tell us a little bit more about what makes the Atlas different than other tools that are out there that are visualizing COVID-19 data?
Yeah, definitely. So it's a absolutely very busy map, dashboard, analytics, and data environment out there. And the Atlas is meant to be complementary, not competitive against those. But at the same time, we do a few things really well. So the Atlas is really meant as a deep dive into the data and true exploration of the data with the goal of understanding the place and space of COVID. So we include those statistical hotspots, leveraging decades of research in spatial stats and modeling. We include and enable immediate access to historical data to better understand how the pandemic is unfolding in near real time. And we also link to dozens of meaningful community, COVID, and health indicators that were brainstormed through a phenomenal research coalition. We're constantly shifting and refining the Atlas to get better, even more better, and even more collaborative, and are open to change and improve all the time.
Yeah, I've appreciated that continual renewal. I know that at the beginning of July, I was really excited to see a new version of the Atlas launch, and it becomes more and more informative each time. So you tempted us a little bit with that phenomenal research coalition. Can you tell us a little bit more about those partners and that coalition that emerged to support the Atlas?
Definitely, and I think that it is kind of a core feature of what we're doing. Our earliest partners actually came from the COVID data science teams at Madison, Wisconsin from back in March, where we got invaluable feedback and stakeholder reviews. Honestly, I feel like that initially started off as kind of a support group for researchers who needed to do something, and we're just learning from each other. Through that, we connected with multiple others to make the Atlas as it stands today. So for example, Dr. Yu's group brings forecasting statistics from Berkeley to help local hospitals plan for PPE needs. CSI Solutions brings a rural health practitioner network that keeps us on task, frankly, making insights accessible and timely. CHR is an invaluable partner in providing that rich county level focus and expertise, building on a decade plus of careful insight. And at UChicago, we also partnered with a library team to improve the accessibility of the Atlas, developed several tutorials that are now on the site, and continue to kind of grow a phenomenal team of developers, analysts, and volunteer contributors. Again, I'm just one of the co-PIs of the project. We also build on multiple projects at the center, especially connected with UChicago Medicine and different health departments in complementary ways, as my pre-COVID research on how place impacts health continues.
So, and I think of all the contributions and the different players in the Atlas. And, I personally enjoy kind of interfacing with the Atlas. I enjoy maps. Who else should be using this content? Is this for everyone, or how do you envision this?
Yeah, so technically speaking, the Atlas is absolutely for everyone, and it's used by a wide variety of users, including healthcare professionals, department officials, business leaders, journalists, and the public. Our kind of primary focus initially was really the healthcare community to provide that kind of the exploratory insight that was needed as a research gap, but we found along the way that there's a lot of other interest as well. So we have a growing community of users, from a major food company executive deciding on factory reopenings, as well as a hairstylist from Mississippi. It will also soon be used in coursework, clinical coursework on understanding pandemics. And all of this is possible because the Atlas is a totally free open source tool and has been a public good since we started it.
So yeah, I think that with all of the data sources out there, with everyone kind of turning to the best information to make decisions for their large businesses, their small businesses, I've really found it to be a really comprehensive place to reflect and think about these data. So thank you so much for that. I would like to turn back for just a moment to our colleague Raquel, because at the beginning of our time together, I asked some of you or all of you to chat in things that COVID data have taught you about your community needs. So I wonder, Raquel, could you tell us a little bit about some of the things that people are learning about themselves?
Yeah, well, we're getting a lot of chats here, so keep them coming. I'm really glad to see so much engagement. So one person said that they thought in their community data collection was really haphazard. Another said data deluge, how do we handle this? Folks were saying that misinformation is a real problem. A couple folks talked about the lack of coordination, even at the higher levels, gaps in services, gosh, so many. Lack of testing in rural communities. Oh, and another one that came up a few times is the need for better surveillance tools, not enough resources, and you know, people not taking enough precautions.
Yeah,
So.
I hear really two big things in there. You know, there's obviously, where's our trusted secondary data sources? The people who are collecting it out there, where do we get the trusted information? And also, how do we look internally and collect our own data, or even think about primary data collection in this case? So really great question. So wow, thanks everyone for lifting up those suggestions. I think now we'll go back to Marynia, because I think that that might lead us really well into thinking about some of the things that people who have been using the COVID Atlas and you as research team have learned as you've done this project.
Definitely. So I wanted to highlight kind of a few of the main aha moments, lessons learned, insights from the Atlas. So one piece was that since we began mapping in March, it became clear pretty quickly that after adjusting for population, rural areas were already emerging as extremely vulnerable to COVID. While there are less people in rural areas, there's correspondingly fewer resources, fewer ventilators, ICU beds, hospitals. Dozens of hospital closures over the past decade also resulted in many counties not even having a hospital at all, especially in the South. These areas also tend to have slightly older and more vulnerable populations, and also tend to have mixed message from local, regional, and national leaders, resulting in mixed adherence to public health guidelines like social distancing or mask wearing. So a few cases can quickly and exponentially grow. We recently compared COVID rates from after Memorial Day, where we started to see a tick overall, to early July, and found that when just comparing kind of rural to urban, there's a 93% increase in COVID in rural areas as compared to urban locales. And another thing to note here is that the data sources, we actually use multiple data sources. So in this case, we're using county level data from USA Facts, but we also do include data from 1.3 acres, which was one of the earliest releases of COVID level or county level surveillance. And then, so moving on to the next kind of insight, the Atlas also shows us how these trends fit into wider regional contextual histories. So several of the rural hotspots we were tracking were actually located in the Black Belt, which is a string of counties across the South with more than 40% African-American population composition. These areas experienced the direct legacy of slavery in the US with persistent community deinvestment and persistently less access to essential infrastructures. So we found that hotspots have clearly emerged within this band and grown over time, especially across the Mississippi Delta area. A patchwork of policies between states make a unified public health approach very difficult. So there's a real regional opportunity for work between states in this area. That being said, while some of the highest rates of COVID have persisted in this area since March, April, they consistently receive less attention in the national discussion on COVID. So our approach has been through kind of discussions with our partners. By adding the black belt as an overlay in the atlas, we hope to shed a little bit more insight into the context of the story here.
I think that was one of the overlays that really caught my attention, because I think for getting that national attention, getting that media exposure, a case can really easily be shown for the connection here.
Definitely. And again, the goal here is to identify hotspots early, so when there's still a reasonable opportunity to contain. And so it was after about May and early June that we started to see counties in southern Arizona and then eventually southern California begin to kind of flicker on as hotspots. And that tended to be happening across a major traffic corridor between states. We use multiple metrics to track and define trends. So for example, confirmed case rates will give us a historical perspective, and then the 7-day average of new cases, as well as just the 7-day count of new cases. So looking at both count and rate will give us an idea of emerging hotspots. So though we could see numbers in southern Arizona and California begin to tick up and eventually move towards a tipping point, there's multiple hypotheses as to why that's happening. Using hotspot detection and ESDA, ESDA is exploratory spatial data analytics. It's essentially the core feature of what the atlas is trying to enable. So using that helps us find trends on the rise, generally weeks before ICU beds are filled, though at the same time, not all hotspots get to that point if they're contained early on. So long story short, the atlas shows us the trends, but not the reasons behind it. In fact, we see that each hotspot has its own story. So it could be initially coming from a COVID transmission at a funeral gathering or a church or a meatpacking plant or essential worker commuting patterns, right? COVID is really a national story with a local experience, and we really need to use all the clues we can get to understand and unfold what's really happening.
You know, and I really appreciate you lifting this trend up. As I've thought about this one more, you know, that's I think Interstate 8 that goes kind of through, and maybe Interstate 10, probably lots of traffic for that. You're talking about essential worker commuting patterns, and those wouldn't show up at a state level, and they wouldn't show up even necessarily at a county level until you start to think about the relationship between these places. So I think it's really important for all of us in this moment to think about how people move through their space as one of the caveats of our response. The other thing that I really want to lift up is that bold statement that you have there at the bottom of the slide, and that says COVID is a national story with local experience, and I've thought about that very often, and I'm guessing that some of the questions that Ali is seeing in the Q&A box have to do with local impact. Before we get to some of those questions, though, I wanted to bring my colleague Courtney into the room, and Courtney, I wonder if you might help me reflect even more on that statement, on that idea of the national story with local experience and what the data implications are there.
Yeah, thanks, Joe. I'm definitely happy to talk about this because we on the data team think about this a lot, how the most actionable data is often local data. And as Joe and Marynia have highlighted, we continue to see disparities at both a national and local level. And understanding these patterns and policies and systems that lead to these is so important. Noting this, there are several layers of context we can think about in regards to COVID and the data gathering process. But I'll focus on two here. So first, we can think about the context in which your community entered the pandemic. I saw a lot of comments regarding that in the chat popping up. And then two, the other theme, how the situation is evolving now. So when thinking about the historical and the pre-pandemic context, it's important to understand where we've been and what has led us here. As Marynia said, we do provide some contextual information directly on the COVID Atlas about rankings indicators we think are important to this situation. For example, what % of your community was uninsured prior to the pandemic? How segregated is your county? Are families struggling to make ends meet? And it's time for us to get curious about what led to these patterns. Beyond these selected measures, we also have a whole host of other contextual measures on our snapshot at countyhealthrankings.org. This can help you explore things like, was housing affordable prior to the pandemic? Or I've seen a lot of things come up in the chat about noting racial disparities. And at our snapshot online, you can break things down by race and ethnicity. And beyond our website, there are other data dashboards you can look at for some of this pre-pandemic context. So data dashboards that come to my mind are Census, also National Center for Health Statistics, City Health Dashboard, or the Eviction Lab to dive deeper. And while these are important things to understand, and we hope that they'll be helpful, we know that given the fast nature of COVID, the data work doesn't stop there. We know that the coronavirus pandemic has widened existing health gaps, and we can see even more clearly that where you live and what job you have influences how hard you're hit by this pandemic. So that brings us to that second part of context. In order to complete the data story or be able to respond to the moment, we need to be able to understand what's happening in real time, which means local real-time data is invaluable. And unfortunately, based on our current data reporting system, it can be hard to find this data on some of these existing dashboards, including our own. And as a data person, I cannot say enough that stories and lived experiences, those qualitative data points, are so important in times like these. So it's things that we're thinking about, and I think that you're grappling with as well, as far as what information are we needing to better understand what is happening. Who in your community can you engage to collect that information? It's important to reach out to a diverse set of stakeholders and residents to better understand what is going on. For example, this might look like community groups and community organizers, local public health officers, hospitals and clinics, and small business owners. Groups like these can help shed light on how evictions, savings, social support, and trust has changed over the course of this pandemic. Lastly, we have a responsibility to center equity in the data collection process. As Marynia has highlighted, this pandemic has hit Black, Latino, and tribal communities and individuals with lower incomes to a greater degree. When collecting data, it's crucial to include communities hardest hit in the decisions about what data to collect, who to talk to, and what actions to pursue. And we can also be thinking about benchmarking our progress based on how groups in our communities who were hardest hit are now faring. And with that, I'll end on just this note that really, in order to stop the spread and to have a just recovery, no one can be left out of the measures or the data collection designed to protect us all, no matter where they live or who they are.
Yeah, Courtney, I really appreciate the things you've lifted up, and I might even emphasize, just as we at County Health Rankings and Roadmaps have done our work, you know, we've been confronted with lots of quantitative data. We're looking at it along with all of you. We're looking at lots of interesting qualitative data, stories about people who've delayed care, how spending habits have changed within households due to the pandemic. So I think as we think about all of the information that we want to gather about our communities, all of this remains valuable, and it really puts us in an important space of thinking about how to contextualize the counts and the rates along with the stories and the qualitative data that's out there. I just am sitting here reflecting on some of the things we've been talking about today, from Raquel lifting up your chat examples of what you're learning about your community and what you wish you were learning about your community through COVID data, what you wish the data looked like, having Courtney talk us through how we collect data and complete the data story. And I have to just step back and think this feels a little daunting, perhaps, and maybe a lot of you are feeling some of those same emotions. So I do want to tell you about some resources that are out there, because I do think we're in a particularly powerful moment to start thinking about how we use data to respond with particular focus for those who are in most need in our communities. So the first thing that I want to talk to you about that's showing on your screen right now is the US COVID-19 community of practice for the Atlas. So the University of Chicago, in partnership with CSI Solutions and County Health Rankings and Roadmaps, have launched this companion to the US COVID-19 Atlas. It's in support of practitioners like yourself, any users of the Atlas who are trying to understand data or paint a more complete picture of the data for their community. And in this space, you'll find a ready-made link to the Atlas, a forum where you can discuss insights, ask questions about the Atlas, and resources to support you in using the Atlas. I'm really excited that members of the County Health Rankings and Roadmaps team are going to be periodically present in the forum to just think about ways that we can help you learn more about your data, help you think about ways to collect data, paint a more complete picture. So I think it's a great place to start exploring the data further, thinking about the context of your community, and moving to action to improve outcomes for everyone. There will be a link to this virtual community in the resource guide that you'll receive after the webinar. So if you can't catch that little link that's present on the bottom of the screen right now, don't worry, it's going to come to you. I have a feeling that Raquel is also placing it in the chat. So don't worry, this won't get away from you. You'll be able to visit this community anytime you need. The second thing that I would like to talk to you about, and this will be my last thing to share before we get to the questions that I'm sure you've been lifting up for Ali and Courtney in the Q&A box, is I want to tell you about the action learning guides that live on the County Health Rankings and Roadmaps website. Just a few months ago, I think it was back in April, we launched 3 new action learning guides that were focused specifically on using data to move to action. We were increasingly confronted with practitioners, community members saying, I want to have conversations about data with my community, but everyone's not on the same page of understanding. We're not all speaking the same language. So we found that to be a really important prompt. So those 3 data guides, they're there to help you think about the importance of using data to explore health improvement. It's got activities, specific information, there are worksheets. There's just so much data saturation out there that we hope that these guides will give users a chance to learn more, gain some confidence, collect their own data eventually, and being discerning of the data that they're seeing everywhere and all the time. They can take you from the basic levels of understanding data up to a more advanced understanding. So we really hope that you'll use these guides, share them with people who you'd like to have these conversations in your community. Now with that, I will take a breath, and actually I'm going to stop sharing my screen because it's time to hear from Ali and some of my other colleagues about questions that might be percolating up that we can answer today.
Yeah, great. Thanks, Joe. And sorry for the pause there. The questions have been great, and we've been trying to do our best to respond. So I had several layers of screens. I might just highlight, and Marynia, we're actually going to ask maybe if you could do a live tour of the Atlas here in a minute, because we've had some great questions. And one thing that's come up is how to navigate to Alaska and Hawaii to see data for those states that are not part of the continental US. So just wanted to highlight that that would be useful for our audience. Yeah, and then so as you're thinking about switching over to pull up your screen, Marynia, to look at a live tour, I'll highlight some of the things that might be beneficial for folks to hear as you're walking through that tour. So one of the things that's coming up is the ways in which, and you touched on this early on, to think about hotspots and potential hotspots. Questions about how to look at the data differently. What, if anything, what ways might it be disaggregated, if at all? And then how to find and access the maps for a specific county. So I'll leave it at that and I'll turn it over to you for a live tour.
All right, let me, I'm going to work towards this live tour option, and if things start to go wrong, just just let me know, Aliana. Okay, so can you see the screen okay?
Yeah,
All
that's
right,
great.
perfect. So this is kind of the default for when we first open up the map. What you're looking at are confirmed cases adjusted by population at the county level. That is being shown right here, and then right here, the data is that is being used to pull this is from USA Facts, which is also what the CDC has been using recently. And until we have a single validated authoritative source, our best practice is to look at multiple data sets. So we start here, and so one option is just to kind of zoom in and zoom out. You are looking at a base map that's actually on a globe. So sometimes if you zoom and your finger slips, if you start to get a angular view of the map, it's really easy to just reset, and that's one way to kind of fix that. But so one option is to zoom in and just mouse through. So if you mouse over here, essentially if there's data being reported in these different, from the different data sets that we're pulling, we also report it. So here you can see Alaska, but if you wanted to instead look for a specific area, let's say Honolulu. All right, I'm going to just, I don't want to, okay. So if we want to look at Honolulu County, it will zoom to that region right there. Okay, so that's another option, is just using this search to plug that in. But let's now go to, so Lowndes County is an area that I've been really interested in. It's in Alabama, not too far away from Montgomery. It's also an area that was in the report. I think someone mentioned that in the chats. There was a UN Commission report on human rights in 2016, kind of calling out some of the community de-investment, infrastructure, mortality outcomes in this area, and Lowndes was featured. So this was an area I've been looking at for a while. So again, you can either zoom in or just kind of click on where you need to there. So that's that. And again, I will zoom out just a little bit further. I can start to look at different attributes that might be interesting to me. So if I want to look at not just confirmed cases by population, but just the total counts, I would switch to confirmed counts. And another thing we can do is look at, so right now the default is on this fixed bin choropleth map. I know that's a lot of jargon, but a choropleth map is essentially a thematic map where data is being shown according to different colors, so on and so forth, right? If I want to instead switch to the statistical hotspot, I can click on that. Okay. Another option is to look at the daily new confirmed cases. Again, once you start to adjust for population, that's generally when you can see the rural areas really show up. We also recently added the 7-day average of new cases by population, which is a slightly smoothed version of that. So if I want to look at hotspots of that, this is to replicate the kind of black belt demo. If I just add the black belt counties right there, I can use my slider to kind of trace back in time. So when we started in March, we had identified a hotspot in Albany, Georgia. Right there, you can see that. And as you kind of progress over time, you can see how that changes or doesn't change. So we recommend to never trust a single data source, but also to never trust a single indicator. It's really important to try multiple indicators and look at the change over time to see how stable the results are, and to kind of get insight accordingly. So here, if I click on one of those areas to get the kind of contextual information, you click on an area and this information pops up on the side. You can close that if you want to have a wider view of it or not. And finally, I just wanted to highlight that in this FAQ page, which I've opened up here, there's a really great tutorial that was written up about emerging trends that will kind of take you step by step through kind of the choropleth maps, the hotspot maps, and then even a view of the time graph that is on the bottom left side. So the time graph is actually always going to show you new cases, and that graph can be really useful to kind of give an update of how things are. Okay, so for example, if we look at Apache County, we can see how that information changes over time. I'll stop there because obviously I could go on for a while, but maybe that's a kind of a good enough quick overview.
I'll interject for just a second, Allie. I know you have other questions queued up. I saw one pop up in the chat for just a second that was talking about why things change visually when we go from rates to the number of cases. So, you know, obviously there's things that have to do with population there, but I would just encourage everyone as they use the atlas to think about what each statistic is telling you, and then that might bring up other questions that you want to think about. So yeah, there's just lots of complexity in there and thinking about which measure at which time is telling the most complete story.
Thanks for that, Joe. And actually, that sort of prompts our second question. And as we think about how to contextualize data, how to explain data and data tools, that doesn't often it might involve jargon. And so I wanted to pivot to Courtney. And I know you sort of sit in the data world, but you also sit in that translation space. And so what are some of your tips or guidance you might offer for helping make data understandable for all?
Yeah, thanks, Allie. It's always a good question and something we're constantly thinking about how to do. And I think a few points that are really important to think about is thinking about who your audience is. So obviously I'm going to explain things differently if I'm on a call with statisticians who maybe speak the more methods area that we use all the time versus a community who's really interested in what they can do to improve birth outcomes, or in this case and in this time, reducing the spread of COVID. So thinking about who your audience is, sort of understanding what their baseline is as far as rates or confirmed counts. And then I think the most important thing when thinking about making data is contextual, is understanding when you pick a data point, explain to your audience why you picked that. What's the value in which that you brought that data point in? What is it measuring? And then what can you do with that? So it's important to show data, visualize it in a way that makes it a little bit more informative than just a list of numbers, right? If you're comparing groups, if you can visualize that, it's going to be a stronger takeaway for your audiences, regardless of their data savviness. Pictures are always better. But then also being able to pivot to what are the options for your end users to do with that data. Also, a last thing I'd say is I'd just like to lift up those action learning guides that Joe highlighted on the webinar, as those also do a really good job of thinking through how to use data and how to present it and think about what data you want to pull in when you're telling a data story.
Yeah, and this next question, maybe continuing to build on this thread, Joe, I might look to you, and as you think about the work that Marynia shared through the Atlas, what would you offer to a community member that might be looking to use the Atlas and perhaps some of the other data sources that have been shared today to engage in either story or dialogue or narrative to help create positive change?
Yeah, I think Courtney started us down that path, and I think that's a really great question. When Courtney was talking, I thought kind of colloquially, we talk about no naked data. We talk about that we just don't put data out there and say, hey, figure out what this means. But we talk about why it's important for our community. We attach it to the history that we're hopefully continuing to learn about our particular place. You know, sitting here in Chicago, I don't know much about what's going on in Honolulu County or in Allie's County or even in Madison where Courtney is. So I'm thinking about my specific community context. I'm thinking about pairing the data with the stories and the understanding that people have here, and also presenting it in a way that's going to be understanding, as understood as possible to my audience. So I think, you know, that starts with me building my understanding of the data, thinking about how I feel comfortable or not comfortable talking about it, starting to talk about that with increasingly larger audiences, you know, scaling this up, continuing to gain comfort, continuing to bring more people into the conversation. and then starting to come together on identifying the real need that's attached to that data to take action.
Great. And I'll toss this last one out, and Marynia, Joe, and Courtney, I'll let you figure out who's best to respond. I think, so thinking, Marynia, to your tour that you did, and it was on the right-hand side of my screen, those additional data sources, some of those coming from county health rankings and roadmaps and other partners that you all have worked with. How would you recommend using those additional data measures and layers, especially the socioeconomic data, to help explain sort of what's emerging trends, what we're seeing in the map? So how would you pair those two in a community narrative?
I can start things off, but I think that that probably is a good question to end with CHR as well. So I really recommend just pure exploration and interaction when you start. So first, kind of look for trends, look for patterns, identify, you know, if you're looking, are you interested in a region and regionally what's occurring, or are you looking at a specific county or city within a county, and so on and so forth. So first, identify the kind of scale that you're interested in, and then zoom in, look at multiple indicators to kind of get a grounding in what's occurring at COVID at that level, and then start to, as you click through the different areas, observe how those indicators are changing across different counties. So, so for example, we had someone that we were working with who was from Arkansas, and immediately they were just the process of kind of clicking different counties to compare this area that was a COVID hotspot. Wow, like that, those indicators, or like the poverty and unemployment rates, are so different there versus a few miles away, right? It's really important to note, though, that they're similar to the opioid epidemic and others, that there's not ever going to be a direct causal correlation. There's things are much more complex and nuanced, and COVID is tricky because it's, you know, it's a virus. So the presence of the virus is important. Regional policies that are occurring in that place are important, and the kind of socioeconomic vulnerability is another dimension. So I think that kind of as you zoom in, the more nuanced, I guess, and just the nuanced you are, and the more respect, I guess, you have for the history of that region, that's usually when you start to uncover more interesting insights. But I don't know, Courtney or Joe, if you had something to add from that county perspective.
Joe, do you want to go, or do you want me to take it?
Well, I'll let you go, and then I'll close us out on that.
Then perfect. I was just going to say, yeah, what Marynia said, I think is beautiful. And I think from a data perspective, I always think about how these patterns aren't happening in a vacuum, right? There's systems and policies and structures that either perpetuate these things or place barriers for people to being able to overcome them. So I think what Marynia was saying about noting these patterns, and then also highlighting what Joe had said in this webinar, is being really curious within your own context and gathering information about what's happening and what has happened that led to these patterns.
And I think that the last thing I might add to this is just thinking about the Arkansas example that Marynia lifted up. Maybe that is the county where the critical access hospital closed, and there isn't that trusted data partner or health provider in the community. So thinking about who are the people that are showing up for this conversation, who are those trusted partners, who are the people who can help collect data, make sense of data, be trustworthy in this process. I'll throw another commercial to the County Health Rankings and Roadmaps website, where there is a partner center to help you think through how to have conversations with partners like that. So, you know, I think this is really an all hands on deck approach. So the history, the context, thinking about the policies and programs that exist, thinking about the partners to help you through this process are all going to be very important. All right, thank you so much, everybody. And the questions were terrific. Allie, thanks for lifting all those up, and for all of the several dozen more that I'm sure you answered in the background without letting them come to the surface for us in the public sphere here. If you do have remaining questions, I know that Joanne Lee, who's going to be heading over to our discussion group in just a few seconds probably, would love to address some of those questions in that space. So if you didn't get an answer that you were feeling was very complete or all the way done in our time here, hopefully we can address it there. So thanks so much, everybody. I'm going to show you just a few more other items to get us ready to move into that discussion group. So the first one that I will let you know about is that we will want to hear from you about this webinar. Our hope, of course, as always, is that you learn something new, different perspective, some new ideas to apply to your work, and we'd love to hear whether or not that's the case. Raquel is going to be putting a link to a very brief feedback survey into the chat box. And so what I would ask you to do is click on that link. You don't have to do it right now, but hopefully a window will open somewhere on your computer, and it will be something that you can answer before it gets away from you later today. I prompted just a minute ago that we're going to be getting ready for that discussion group. Joanne, I'm sure, is very interested in learning a little bit more about what you would like to discuss in that discussion group beside those pending questions. So I'm going to ask James to launch a poll really briefly. And if you could take just a second, and I'm going to give Ali a break here from all those questions, and just ask if you could answer the question, what would you like to exchange ideas about during the discussion after the webinar? So several of you are already finding the options there. You would like to learn more about mapping for data visualization. You'd like to learn more about collecting your own data. You'd like to learn more about including equity in local policies for addressing COVID-19. And the last option, you'd like to share what your community is doing for COVID-19 response. I think all of these are terrific options, so I appreciate your thought. I'll give this just a few more seconds so that we can see where everyone's energy is right now. And then I'll let you see that I think this is terrific. People are really thinking about the members of their community, the places where there's disparity, and thinking about including equity in local policies for addressing COVID-19. So I think that's a terrific topic that I'm sure that the discussion group will have some time dedicated to. So I really appreciate everyone participating in that poll and thinking about joining that discussion group. All right, let me stop sharing there. There we go. Got too many things going on my screen. 2 more slides to go, I promise. We're almost there. So I would like to also let everyone know about our Special Topics webinar series. And maybe this is your first webinar with County Health Rankings or Roadmaps, or maybe it's your 15th webinar with us. But I want to let you know that we have an ongoing health equity and social solidarity in the time of the pandemic webinar series. So all summer, we've been thinking about challenges that communities are facing as they respond to COVID-19. Even if you happen to miss some of those, like the disproportionate impact on Black communities or the disproportionate impact on tribal nations, you can view all of these webinars on the County Health Rankings and Roadmaps website. We do have one more webinar in this series. That will be the 5th. It's on Tuesday, August 13th. And the title for that one is Responding to Crisis in Latinx Population with an Equity Lens. So we hope that you will join us for that one. Our colleague Justin Rivas will be helping to facilitate that one. And I know that it'll be a great conversation as well. My last commercial for you is that I hope you will stay in touch with us. Follow us on Facebook. Well, I guess it's like us on Facebook. I got to get my terminology right. Follow us at CHR Rankings, to follow us on Twitter. I know that on August 11th, we're going to be having a Twitter chat with our partners at Salud America to talk specifically about the COVID-19 Atlas, why local data and disaggregated data is important to our response. So we hope you'll follow along and participate in that. Make sure you sign up for our newsletter. It's always a great place to stay in touch with us and continue the conversation with us. And now that we're at the top of the hour, I'd like to give a huge thank you to our guest Marynia and all of my awesome colleagues around the nation, Ali, Courtney, Raquel, and James, for the work they do. We hope you'll join that discussion group to continue the conversation, and we'll see you at our next webinar in August. Thanks so much, everybody.